Welcome to Growth Happens in the Dirt. I'm Katie Jolly, a Dr. Amen elite brain health trainer and naturopath, and this is my story of brain injury and a pathway to heal, which will hopefully help you and your loved ones. I wrote the book for survivors and their families, and then realized I couldn't actually read or tolerate screens for several months after my concussion. So if this is where you are, this is for you. Each week, I will read a few pages of the book, now available on Amazon, which, along with my story, contains clinically proven tools and methods to heal. Growth Happens in the Dirt, Chapter 2, Tools. Get checked immediately. I didn't go to a doctor after the accident, and people have asked me why. Firstly, I didn't understand concussion, and my knee was in more pain at that moment, taking focus from the blurred vision or the headaches. I have had multiple head injuries during my lifetime, falling into a brick wall at 4 years old, which split my eyebrow, a fall from a tree onto a concrete slab, which knocked me out at about 9 years of age, and a slip on a parapet floor that left me in a neck brace for 6 weeks. But on all those occasions, although my mood was unstable and the pain intense, I and those around me, including doctors, had no knowledge of the full effect of concussion. As a naturopath, we never studied the brain, let alone the impact of compound concussions on brain health. I had no idea of the impact a concussion could have on the brain, as I'd never learned anything about head injuries during my study. I didn't understand brain injuries or even the notion that post-concussion was a thing. From years of boxing and intense sport, my tolerance for pain was very, very high. And somewhere in the back of my mind, I was downplaying the symptoms I was experiencing. Yes, I was in pain and my mood was sliding downwards, but I didn't have any blood apart from my black eye on the next day. So I felt that I could keep going. Ignorance escalated and prolonged my healing. My mindset was to keep doing, so I tanked up on painkillers, ADHD meds, and caffeine to keep the brain active. Secondly, our business was crumbling because of COVID, and with little time to sit around and feel sorry for myself, I ignored my pain and sank my teeth into work. Many of the psychological symptoms with concussion can mirror stress, and to say we were stressed is a light statement. There were so many holes in my knowledge that I put up with the increasing symptoms until crisis point. When I did contact the doctor after my mental health snapped, and it was during COVID, so all consultations were remote, he referred me to a local physiotherapist who specialised in concussion. At the time, in our town, few doctors understood concussion, so the protocol was to outsource to a specialist team. From Colin Hancock, the concussion physio specialist, I was referred to the concussion rehabilitation team. In hindsight, I should have gone to the hospital immediately, yet as you'll see in the story, we all live and then learn. A concussion is an injury from a direct blow to the head, neck, or face, or a force directed somewhere else on the body that transfers the force to the head, like a car accident. Symptoms can occur immediately, or they may evolve over time. Any type of head knock or accident should be immediately checked out. You don't have to have a blackout or have cracked your skull to have caused damage to your brain. The brain is like a ball of soft butter set into a case with spiny ridges, so any large impact to the head can cause concussion, like falling out of a tree, falling off a bike, falling down the stairs, falling over when you're drunk, right? Also, repetitive head knocks over time can cause brain injury, such as so many of the contact sports and falls, and this may extend your recovery time. Only 5 to 10% of concussions result in a loss of consciousness. Know who your team is. It is very easy when faced with adversity to forget that your family is your team. In sport, attacking the players of your team makes no sense, and yet we often claw at those closest to us. Rather than banding together, we fall apart and use each other as the landing pad. So as you move through your healing journey, know your team. They will be the ones who are there through the worst of your days and hopefully will still be standing beside you as you heal. Stress. Stress is an interesting mistress. When you are recovering from concussion, all your emotions tend to be heightened. The brain resorts to its primal instinct of fight, flight, or freeze. During periods of intense stress, your immune system is weakened, so you are more likely to be sick. Your digestion is impaired as your blood flow is shunted away from the gut to your limbs to prepare you for action. This is why a brain injury can mirror many other mental health disorders such as stress. You may be experiencing anxiety, depression, mood swings, rages, all of which align with a brain feeling fried. With concussion, the normal everyday moods are hit with radioactivity and feel like triple the normal response. When you are stressed, the blood flow to your brain decreases, and you may experience increased heart rate, breathing high into your shoulders, inability to think clearly, and mood swings. We feel unsafe, so the amygdala fires. When we feel stressed, the amygdala fires. You will fight, flee, freeze, or fawn. I like to say fall in a heap, but overwhelm with concussion happens a lot faster than ordinary stress because our tolerance is depleted. Using calming techniques regularly while you are healing can help you to self-regulate emotions. The most important tool for concussion recovery or stress is to learn how to calm down and take a brain bath. And here are some ideas for brain bathing. Sit in a dark cupboard with noise-cancelling earphones and focus on breathing in for a count of 4, hold for a count of 4, and breathe out for a count of 4. So this is traditionally called box breathing. Breathe deep into your belly until you feel calm again, and do this for a minimum of 5 minutes. You could listen to a binaural beats track. The audio helps the brain to relax. You can do eye palming. Rub your hands together for 30 seconds, then place over your eyes for a minute. Take a warm shower for 5 minutes. Look at a photo of something you love or somewhere you love for 2 minutes until your breathing regulates. Go for a walk outside in nature, and while you are walking, breathe deep into your belly. Notice the sounds, sights, smells, and sensations. Wear a cap and sunglasses and even earplugs to avoid overstimulation. So just like gardening, in order to heal, we need to weed external stimulation, which are noise, screens, and sometimes people, feed, deep belly breathing, calming music, and changing your environment, and seed, take regular brain baths during the day. Every day, change your environment twice. During the concussion recovery, you may want to stay inside all the time. Yet a powerful tool for mental health is to change your environment at least twice during the day. It is important to get vitamin D via sunlight to help your brain to function well. Rolling up your sleeves and getting 10 minutes of sunlight onto your forearms will help with vitamin D levels. If you're going for a walk or sitting outside in the first stages of your journey, ensure you wear a peaked cap, use noise-cancelling headphones or silicone earplugs, wear sunglasses, and you may want to set a timer for 10 minutes if the light is too much for you. Concussion symptoms. With head injuries, you may not know that you have hurt your brain. I boxed for a few years, only one fight to claim, and had previous falls as I've described. Yet apart from the muscle soreness, before this time, I did not understand how fragile the brain is, nor the symptoms or major effects that concussion can have long term. If you've had a major accident, you will already know that your brain has been compromised. But as I said earlier, you don't have to experience blackout to suffer a brain injury. However, if you're a sports enthusiast or have had a knock to the head which didn't leave you in hospital or blacked out, there are very clear signs to watch out for. Always take a head injury seriously. If you have any of these symptoms, get medical attention immediately. Sensitivity to light and noise, headaches and pressure behind the eyes or in the skull, brain fog and memory loss, insomnia with sudden onset, meaning it hasn't happened before, mood changes, speech or body movement changes, numbness or tingling, which can involve the neck, irrational behaviors, spending more money, poor decision making, etc., concentration issues, balance issues, hearing changes or loss, including ringing or buzzing, and vision changes, especially for children whose may have had a fall or injury due to sport. It is vitally important to rule out brain involvement. If you're a parent and you find that your behavior of your child has changed since an accident or through contact sport, then take them to a professional to get them assessed. It is vitally important to rule out brain involvement. If you are experiencing these issues, see your doctor immediately and ask to be reviewed for post-concussion. There are specialists who deal with concussion that can perform assessments. Migraine. A migraine is more than a headache. It can cause debilitating throbbing in one part of your head that can leave you in bed for days. And it is very, very common for migraines to be triggered post-concussion. So triggers for migraine can be movement, if there are structural issues in your neck, bright lights or sunlight, sound, hormonal changes, dehydration, low blood sugar. I suffered from migraines before my head injury, before this one anyway, and looking now at the multiple knocks that I had to the brain, it's no wonder that I had migraine for most of my life. So migraines may have pre-symptoms before they arrive. So you may see auras, which appear as bright flashing lights, dark spots, or swimming vision. In an ocular migraine, sometimes the vision can completely go in one or both eyes. Sensitivity to smells, strange sensations like crawling on the skin, and nausea. These are just some of the symptoms. An ocular migraine, ocular meaning eye, may involve losing vision or partial vision in one eye with the associated pain. And migraines are a common side effect of concussion. So when you have a migraine, the following may help. And if you've got migraines, you probably know some of these, okay? But some of these may help you. So you may lie in a dark room, which most of us have done before. Another one which is interesting is you can use an ice pack on your neck or on the top of your head. You can drink a glass of water with a pinch of Himalayan salt, especially if you suffer from low blood pressure, which again, blood pressure changes can be very common with concussion. Eat some sort of protein and fat if the migraine is associated with hunger or low blood sugars. So if you haven't been eating during the day and you suddenly get a migraine, it may be that you have some sort of hypoglycemia, which we go into later. And again, that is common in concussion as well. So, walnuts containing omega-3 have been shown to help a migraine. Go for a walk in the fresh air if you have been sedentary, and place lavender oil on your wrist and inhale the smell. So, thank you so much for listening to chapter 2, talking about the very first tools for concussion. And I hope you have a wonderful week. I'll see you next week with a few more pages of the book. Keep shining.